have to stop me when it is not true. So if it is not true, you raise your hand or you do a lot of noise. Yeah? Don't raise your hand because I don't see very well. Just do a lot of noise and say, not true, okay? The social protection floor provides a basket of minimum social security entitlements for all. Okay, seems to be true. The social protection floor should be guaranteed for all. Okay. The social protection floor can be different across countries. So, who said no? So who wants to explain why yes, why no? It's interesting. Brema, you have an idea.
I think it is not true because it is because it's a flow, and I believe the universal access has to be there. So I think it's not totally true.
So okay, Jitima wants to say something.
Well, reason I said no because social protection law is the full guarantee, which is for all, and every country should have this. But the content of it might be defined differently depending on the country context. You said that in your slides, isn't it?
Just to make it clearer, so you say maybe the implementation of social protection law can be different across the country depending on the local context. So the principles still be the same, but then the implementation of it can be different. Okay. So nobody wrong.
But it can be, the implementation can be different, the content inside the guarantees can be different, but the principles are shared. The social protection floor is only for the poor. Okay, so it's for everybody. The social protection floor is the first step towards higher levels of social protection. The social protection floor is good for growth. Okay, this one is a bilingual one, so it's for Charles. The social protection floor, j'adore. Many people understand French then. We have to pronounce floor with the French accent as well. The social protection floor, j'adore. The social protection floor is a floor, not a ceiling. What does this mean? We start reasonably, huh? Yeah. The social protection floor is an investment in human capital. Yes. Okay. So one more slide, and then we are done. This is our Pentagon. Actually, in this region, we are working, as you know, already on the assessments, but we don't do only that. For us, the assessment is really a starting point. It should be, we should start by the assessment in all the countries, because first it gives this overview of social security situation, and we come up with recommendations that we develop all together with the costing, and we can really help in the planning of social protection extension. No? But then the assessment can be part or a very useful tool when supporting the development of national social protection strategies and also umbrella laws, social security laws. Yeah? There is one which has just been developed, I think, in Myanmar. Ideally, for us, it would have been great to have the assessment just before the development of the law, because when you develop a social security law, you have this engagement of the whole society on what is good for the country. In Indonesia, we were more lucky because now they are supporting the government in the development of the new law called the BPJS, I mean the implementation of this law, which is the BPJS 1 and 2. And fortunately, we already have done most of the assessments, so we know more or less what is the situation in Indonesia and what are the recommendations that came from the assessment. Then, if the recommendations are endorsed by the government and if the government wants to push them, The next step is the implementation, and here the ILO, as you know, as many other UN agencies, is ready to provide some support in implementing the different schemes. So we have with Céline a number of projects on unemployment protection, when Jean-Claude was here, project on health, etc. So we are working on the different contingencies at a practical level. Another thing which is important for us is that the social protection floor, if it's designed and planned centrally, the implementation cannot be centrally, of course, because the beneficiaries are scattered everywhere in the country, and usually the people that we will target in priority are the people from the informal sector, the poor, etc., people who don't have access to information. So for us, we are starting working in Cambodia and Indonesia on how to implement these national social protection strategies, how to implement the social protection floor in a very concrete manner. And we have developed a new tool that we call the single window service, which really will provide to all the people access to information, registration under the different social protection programs, and will enable the government as well to monitor the implementation of the national social protection strategy. So this is the fifth area. And of course, we do a lot of training and research at the regional level, and we try to develop educational tools as well, because social protection is to some extent perceived as quite technical. Actually, you could see with the example of the film from the Youth Forum that you can explain things, even things which are complicated, with simple words. So for us, it's a key area of work as well in this region. And we base all our work, all these 5 areas of work, on, of course, our standards, and mainly, as Céline explained, the Convention 102 and Recommendation 202 on social protection floors. So this is the end of our presentation. Do you want to raise some urgent questions now?
The first question is whether ILO have a certain standard of the level of protection that must be met by all people in the region, or and the second question is, how do you measure this level of protection? Because I've been studying it for quite some time, and there are many ways of defining levels of protection.
Yeah, these graphs are very schematic, huh? And we could put this graph for all the contingencies as well, for health, for etc. Huh? And I agree with you, the way you measure is not the same if you are talking about health, unemployment, etc. Huh? The way you measure access to healthcare, first you need to know what is essential healthcare. This is not, not defined. It has to be defined by the country as well. What is for sure is that if you have, like in Indonesia under the Jamkesmas program, if you have, now it's changing, so with the BPJS 1, finally the Indonesian government is defining exactly what they want to put in the benefit package, which is guaranteed for all the poor. Yeah? But before, with the Jamkesmas program, which is still ongoing now, there was no defined benefit package. So they were saying, yeah, if you go to the hospital, local hospital, you will have access to healthcare, but which healthcare? Yeah? And if the amount of the cost per capita, so the amount of the budget which is allocated to each person who is covered under this scheme is so low that anyway you will have nothing when you go to the hospital, for me, you don't cover really, you don't provide really a guarantee of coverage. You know? Now that we have a more better defined benefit package, people will be also able to appeal and to fight in case this benefit package, although it's guaranteed by law, it's not really in practice, it's not really there. Yeah? For unemployment, for pensions, etc., we said that it's to provide income security. So for a long time we had a clear reference to the poverty line, but now I think we no longer have this reference. Again, it's very difficult because if we are talking about a package of social protection guarantees, where do you stop? If you provide a level at the level of the poverty line for this package plus for this benefit, and at the level of the poverty line for this benefit and this benefit in a family, you may finally have much more than the level of the poverty line. Yeah, so it's very difficult to set a level. What is for sure is that you can use different standards or different criteria to set the levels of benefits. You can use the poverty line. You can use also the minimum wage. In Thailand, where you have a minimum wage now of 300 baht per day, for some social protection provisions, we can use a share of this minimum wage, which has been done already, for instance, by the Social Security Office for their benefit package for the informal sector. When people get sick and they have to go to the hospital and they cannot work for a few days, they will receive 200 baht, which is 2/3 of this minimum wage.
How do we differentiate between sickness, ill health, work injury, and invalidity? How to define these areas, because they are also quite interconnected? And when is it reached? If you have it, yeah, thank you.
Sickness, it's a sickness leave. It's a replacement of your salary, your income if you cannot go to work. Then ill health on this slide is the cost expenses incurred by medical care. So it helps you to bear the cost of hospital, drugs, doctor visits and others. Your question was also how to differentiate working injury and invalidity. Working injury or employment insurance injury, depends on the name that the country adopts, is really related to an accident or occupational disease, accident at work, or occupational disease. So it comes under a special insurance fund, usually funded by employers and workers' contribution. And disability or invalidity, on this slide, it's more universal. It's not necessarily due to an accident at work, but it can be either for persons who were born with disability or person facing accidents which left them with some disability, but not necessarily at work.